Lisa Broyles with Way to Health MD, and this video is about how chronic inflammation affects your immune system. I want to answer two questions today. First, how does inflammation affect your immune system? And second, what can you do about it? So when your immune system goes awry, you either get sick all the time, which is a low functioning immune system, or your immune system starts attacking itself. This is called autoimmune diseases. This is where your immune system becomes dysregulated. It loses the ability to interpret self from non-self. This is conditions like Hashimoto's and Graves' disease for the thyroid, or multiple sclerosis, or lupus, or rheumatoid arthritis. There's a host of autoimmune conditions. So all of these conditions, both a low immune system and an overactive immune system, which is the autoimmune syndromes, all arise from years and years of chronic inflammation. So your immune system can be under attack from inflammation for 20 years or more before you ever begin to have any clinical symptoms. There are some strategies to tell if there is an autoimmune disease in progress, such as Hashimoto's for the thyroid, for example. So if you are starting to notice that your thyroid is slowing down a little bit, your doctor should check your thyroid antibodies. This is anti-thyroglobulin and anti-thyroid peroxidase, two different thyroid antibody markers. If those are elevated, even though your TSH or your thyroid levels may be normal, but just slowing down a little bit, but if those antibody levels are high, you are in the early stages of Hashimoto's or autoimmune disease, and it's always better to figure out what is causing that inflammation, fix it, and you can prevent yourself from developing those autoimmune conditions. So there's a lot of different inflammatory triggers that we've discussed in our other videos, but these include poor lifestyle choices like not getting enough sleep, not dealing with your stress appropriately, eating poor food choices, not getting enough vegetables, basically an antioxidant-rich foods, not eating organic foods, not exercising enough. Some genetics predispose people to inflammation if they have a mutation in their genes such as the MTHFR or an ApoE4. These are easily tested, although not covered by insurance. They are worth knowing if you have them. So certain genetics can make you get inflamed more quickly and stay inflamed and have a harder time getting rid of the pesticides, the plastics, the toxins that we inadvertently take in our routine. So as a functional medicine practitioner, when someone comes to me with an immune dysregulation, be it a low immune system or an overactive, I want to figure out what are those triggers. Okay, so I'm going to look at your vitamin levels, your toxin levels, talk to you about infections or environmental occupational exposures to things like heavy metals or solvents or plastics, or have you been using chemicals to strip furniture, or are you a hairdresser? There's a lot of different occupations that increase your risk of chemical exposures that can then throw your immune system out of whack. So we identify these triggers and then we fix them as best we can, whether that's vitamin supplementation, or chelation if we find heavy metals, or improving vascular health if we find that there's low oxygen uptake and high vascular disease. We work on lowering cholesterol. So there's lots of ways that we can reduce that chronic inflammation. And as I've discussed in other videos, that chronic inflammation looks like increased what are called cytokines, inflammatones, increased histamine production, changes to the way your immune system reacts to itself with your T cells and your B cells and your antibodies. You can actually generate antibodies against yourself. So that's what these autoimmune diseases are. So my approach is to figure out what's causing it, what is causing that chronic inflammation, all the things we just discussed, and fix it as best I can. Very successful with this, so I would love to talk to you more. Thank you.